Advocating for full practice authority in California for advanced practice registered nurses. Nationally, there are three levels of practice for a nurse practitioner. There's full practice, reduced practice, and restricted practice. California is a restricted practice state, which means that nurse practitioners must work under the supervision of a physician. Our challenge is to advocate for full practice authority in California for nurse practitioners. The first nurse practitioner program was started in 1965 in Colorado, and that makes it 55 years that nurse practitioners have been around in the healthcare business. And it's strange to think that in all those years, there have only been 23 states and 6 territories which have granted full autonomy to nurse practitioners. In the remaining states and territories, nurse practitioners must continue to work under some form of supervision by a physician. In terms of the agenda for this issue, the largest problem facing healthcare in this country, or one of the largest problems, is access to healthcare. The Association of American Medical Colleges predicts a shortage of up to 139,000 physicians by the year 2033. Nurse practitioners and physician assistants are part of the solution to this problem, and so it's ironic that the physicians themselves are putting up the greatest opposition to full practice authority for nurse practitioners. Nationally, the American Association for Nurse Practitioners is the organization which advocates at the federal level for the advancement of nurse practitioners and for full practice authority for nurse practitioners in all states. But each state tends to have its own chapter, and in California, it's called the California Association for Nurse Practitioners. This association has been really the champion over the decades for trying to pass full practice authority through the state legislature. They've done extensive literature reviews and studies, and most tellingly, a 2015 study made the pronouncement that, quote, nurse practitioners provide primary care similar or superior to physicians, and that nurse practitioners are prepared and capable of providing safe and effective primary care. Over the years, there has been much evidence to support the argument that nurse practitioners should be autonomous and have full practice authority. And many studies have found that nurse practitioners provide care that's equal to or better than physicians. It's provided at a lower cost than physicians can provide it. Nurse practitioners are more likely to practice in underserved areas. Nurse practitioners practice more holistic care and actually have higher rates of patient satisfaction than physicians do. The fight in California for nurses to obtain full practice authority has been going on for decades and has been lost each time it has reached the state Senate. But it seems as though the momentum driven by other states recently granting full practice authority is making this current battle a little more likely to succeed. Currently, there's a bill in the California State Senate called AB 890, which would actually grant nurse practitioners full practice authority. It has been passed by the state assembly already, and it has actually passed through one of the Senate committees and is currently due to be heard by the Senate Appropriations Committee anytime in the next week. So now is a very exciting time for nurse practitioners in California. Even among the states that do grant full practice authority to nurse practitioners, there is a tremendous variety of requirements to actually obtain that full practice authority. Some states will grant it immediately when the nurse practitioner is board certified. Other states have more stringent requirements, which include typically amounts of time required in, for lack of a better word, internships or working with physicians. The proposed law for California will require a nurse practitioner to complete a 3-year transition to practice, which is one of the most stringent requirements in the entire country. So who are the key stakeholders in this issue? Well, anyone in California who is looking for access to lower cost healthcare or even improved access to healthcare is a stakeholder. Private health insurers are stakeholders, but so are the government-paid programs such as Medicare and Medicaid, because nurse practitioners have been shown to provide care at a lower cost than physicians. Nurse practitioners are obviously stakeholders, as are legislators. And then the opposition groups are also stakeholders on the other side of the argument. And these are almost exclusively physician groups and physician lobbying groups. It's really quite remarkable to think of the power of the physician groups in restricting nurse practitioner autonomy when so many important organizations, both government and private, have recognized that providing nurse practitioners with full practice authority is a beneficial thing to do to the U.S. healthcare system. You can read the quotes yourself, but for example, the Institute of Medicine recommends that advanced practice registered nurses should be able to practice to the full extent of their education and training. The Federal Trade Commission says reducing undue restrictions on APRN scope of practice can be one significant way to help ameliorate existing and projected access problems. And there are other recommendations from powerful national groups as well. The California Association for Nurse Practitioners coordinates the coalition known as Close the Provider Gap Coalition, and the next 2 slides just list all the interested bodies and members of the coalition who are just people and organizations in California who believe that nurse practitioners should have autonomy and be allowed full practice authority. And so the list of all the members on the coalition is included just to show how strongly the people of California feel about this issue. As previously mentioned, the main opposition to nurse practitioner full practice authority in California are physician groups, and the primary one of those is the California Medical Association, which is a very powerful, wealthy group of physicians and lobbyists. And on their website, they make it very clear immediately that they have the best advocates and lawyers in the capital. They also make a number of claims about nurse practitioners, which have been disproven by study after study after study, and it's frustrating to see their statements up there since they are not evidence-based. And these statements include the fact that the bill would remove critical patient protections by allowing NPs to practice unsupervised. It's a dangerous bill to move forward and will do nothing to improve access to health care. And also a claim that nurse practitioners would raise the cost of health care due to nurse practitioners ordering more imaging services, tests, and pharmaceuticals. In terms of strategy, the California Association for Nurse Practitioners has been the body that's really led the fight for autonomy for nurse practitioners in California. Their website is very comprehensive and well organized and includes links to advocacy, how to be an advocate. They have education and training on how to actually advocate effectively. They have links to the bills that are currently in progress. They have activities such as Lobby Day, which is an annual event where nurse practitioners meet the lawmakers in Sacramento. They have an award for the Nurse Practitioner Advocate of the Year, which goes to a lawmaker who has supported issues related to nurse practitioners. And in addition to these activities, they post educational videos on Facebook and YouTube. They have Twitter accounts, Instagram, LinkedIn, and they also have ongoing leadership training and educational conferences to better prepare nurse practitioners to themselves promote policy change. Some of the nationally recognized benefits for full practice authority for nurse practitioners include improved utilization of nurse practitioners' services. and also more services available to rural and vulnerable populations. A significant reduction in the number of emergency room visits as patients are able to access nurse practitioners for their basic health care. Following along with that is lower rates of hospitalization, lower cost of care, and also, interestingly, a reduction in prescription of drugs which are linked to overdose deaths. So in conclusion, California is really behind the curve in terms of what the rest of the country is doing. The healthcare system is denying access to millions of residents, leaving them with suboptimal health. 23 other states and 6 territories have already granted nurse practitioners full practice authority and allow them to practice autonomously. And it is really time for California to recognize the benefits of granting full practice authority and place the interests of the people first. Whether you're a California resident or not, or a nurse or not, or a nurse practitioner or almost a nurse practitioner, this is an opportunity for you to visit this site and voice your support for full practice authority for California nurse practitioners. This could turn out to be a historic week in the battle to gain full practice authority in California. So please go to the site and show your support. Thank you very much.